Did your doctor recently order some blood work for you? Here is what most people don't even realize, that by the time your doctor's lab tests find something, it's already too late. Most traditional lab tests are reactive. In other words, they don't detect disease until after it's already developed. I'm Dr. Joanette. I'm an ER physician as well as a professor of medicine. I was trained to detect disease after it developed, and this is the way most doctors today are still being trained. We aren't trained to test for disease before it occurs. And here's the heartbreaking part about it. Now, as a physician in the ER, I often have to tell a patient that they're having a heart attack or a stroke or even new onset diabetes. And they say to me, "But doctor, how can this be? I was just at my doctor and they told me all of my lab tests were fine." And I have to tell them, that's because the lab tests that most doctors order only detect disease after it's developed. They don't detect disease before it happens, when it's still upstream. And they don't tell you if you're developing a disease 10 or even 15 years before it actually occurs. But here's the good news. Today, I am sharing with you the 7 blood tests that can actually detect disease before it develops. The first test is a fasting insulin level. When we go to get our blood work done, almost every single doctor will order a blood sugar, and many of them will also order a hemoglobin A1C. That is sugar that gets stuck to your red blood cells. But here's the problem. Neither one of these tests detect diabetes before it develops. Those numbers don't go up until after the damage is already done. So by the time your blood sugar is high or your hemoglobin A1C is high, you are already on the path to diabetes, or you most likely already have developed it. We now have an earlier test. It's an early warning sign, and it's called a fasting insulin level. There was a famous study done. It was called the Whitehall 2 study, and in this study, researchers found that people had high insulin levels up to 13 years before they were actually diagnosed with diabetes. That is because our body keeps pumping out insulin to keep our blood sugar looking normal, but behind the scenes, our system is struggling. If you think of it like this, your body is a car. Blood sugar is the speed that car goes, and insulin is the brakes that control the speed. When your brakes start to wear out, your car will still continue to go the same speed until one day the brakes fail completely. That is diabetes. Your fasting insulin will tell you if your brakes are already wearing out. If they're working too hard, it will be one of the earliest indicators of early diabetes. Your fasting insulin level should be between 2 and 5 optimally. The closer to 2, the better. Test number 2 is apolipoprotein B. ApoB. What is ApoB? Think of your bloodstream. It's like a highway, and the cholesterol that is in that bloodstream doesn't just float around on its own. It has to travel in little vehicles. Those little vehicles are called lipoproteins. Some of those vehicles are dangerous, and they crash into your artery. And when they crash into your artery's wall, they cause the plaque to build up. That is the beginning of what will lead to heart disease. ApoB is like the hazmat label that is on each one of those dangerous trucks. When you test for ApoB, you are counting how many dangerous trucks there are on the road, also known as your arteries. And the more ApoB, that means the more dangerous trucks, the more traffic there is, and the higher likelihood that there will be the risk of a deadly crash, also known as a ruptured plaque. Standard cholesterol levels will only measure how much cargo is in those trucks, but the ApoB tells you how many of them are actually out there in your arteries. You can have a normal LDL level and still have too much ApoB carrying all of those hazardous particles. What this means is that you are still at risk for developing heart disease. So the bottom line is, get your ApoB measured if you are serious about preventing heart disease. Your ApoB should be below 80. If this kind of information has been eye-opening for you so far, and you also want to stay one step ahead on your health, go ahead now and hit that subscribe button. Thank you. In these videos, I will share real science-backed insights to help you prevent disease before it starts. After all, you deserve to understand your health, not just react to it. Okay, let's get going, because this next test is one that surprises a lot of people. This test is homocysteine. Homocysteine is a natural substance that your body makes when it breaks down protein. All of that is a normal process, but when your homocysteine levels get too high, they are quietly damaging your blood vessels. This increases your risk for developing heart disease, stroke, and also blood clots. It is because it is irritating to your artery walls, and it increases inflammation within those walls, which makes your blood more likely to clot. Even if your cholesterol levels are fine, if you have a high homocysteine level, you can still harm the vessels leading to heart disease. The most common cause of a high homocysteine level is a low vitamin Bs, either vitamin B6, B9, or B12. All can contribute to a high homocysteine level. There's a couple of other things like your genetics or maybe kidney disease, but the most common one is readily treatable by taking a good vitamin B supplement that includes the 6, 9, and 12. Make sure that your homocysteine level is less than 10. Test number 4 is high sensitivity CRP, also known as C-reactive protein. Heart attacks don't just come from clogged arteries. They can often come when your arteries get inflamed. So even if your cholesterol and your blood pressure are great, hidden inflammation can still be putting you at risk. That is where a high-sensitive CRP test will come in. It's a simple test for low-level inflammation, especially that inflammation that is in your arteries as well as your brain. Think Alzheimer's disease. Think of it like a smoke detector for your body. There may not be a fire yet, but that smoke could mean one is on its way. Bottom line is that high sensitivity CRP doesn't replace any of the other tests like your cholesterol testing. It just adds some vital insights, and it can also give you some early warning before you actually develop heart disease. Your high sensitivity CRP should be less than 1.3. Test number 5 is a vitamin D level. Vitamin D helps our body absorb calcium, which keeps our bones strong and healthy. But that's not all. If we have low vitamin D levels, it is linked to not just weak bones, but also muscle pain and even chronic inflammation. Without enough vitamin D, we are all at higher risk of developing osteoporosis, joint pain, and even fractures from what could be small, insignificant falls. So keep your vitamin D level optimal at about 75, not just normal. Test number 6 is a uric acid level. Most people, when they think about uric acid, they think gout, but it's not just about gout. When it gets too high, it is also a warning sign for much more. High uric acids can lead to kidney disease, heart problems, as well as metabolic issues like high blood pressure and blood sugar problems. Your body naturally will make uric acid, but it can make too much, and that higher levels can damage your kidneys as well as your blood vessels. It's silent, and the damage is going on long before you may develop any symptoms of that damage. So when you check your uric acid level, it will give you a window into your overall health, not just the health of your joints. For all of us, an optimal uric acid level is below 4. And test number 7 is a red blood cell ionized magnesium level. Most people don't realize that a standard magnesium level does not give the full picture. That's because less than 1% of your body's magnesium is actually in your blood. The rest of your magnesium is stored inside of your cells and your tissues, so even if your blood test looks normal, you can still be running low on magnesium when it really matters. That is why your red blood cell ionized magnesium test is a better test for your magnesium, because it tests for magnesium inside your red blood cells. It is much more accurate. It will show you what's really going on inside your body, especially if you're dealing with things like poor diet, lots of stress, chronic illnesses, or symptoms like fatigue, muscle cramps, or even brain fog. So next time you get your blood drawn, ask your doctor for that red blood cell ionized magnesium test. It will catch deficiencies that a regular magnesium test might just miss. So remember, magnesium plays a huge role in your energy, your heart health, your mood, your sleep, as well as how well your brain functions. That red blood cell ionized magnesium level should be about 0.2 to 0.6 millimoles per liter. The truth is, the lab tests your doctor orders are very important, but they may only tell you part of your story. If you want to know what is really happening, and if you want to know if you are developing diseases before they are going to show up on the standard blood tests, ask your doctor for these 7 tests. And what they will do is give you a 10 to 15 year head start on your health and on preventing the most common chronic diseases. I'm Dr. Joanette, and I believe that prevention is the most powerful medicine that we all have. If this helped you, please take a moment right now and subscribe to this channel, because here's where you will get real science-backed ways to take control of your health. Also, for more tools, tips, and some more early detection resources, go to my website, growwithdrjoanette.com. Why? Because your health journey starts now, before the diagnosis. Thank you for watching, and I'll see you in the next video.